Hello, and welcome back to my blog of powerful lifestyle tips. We have been discussing what parents need to know about COVID-19, and I will address some specific and additional details of what parents can expect as we begin to reopen. This is tip number 5, how can I determine whether it's okay to send my child to school? Now that schools have reopened around the country, some with in-person learning, some with remote or virtual learning, and some with a mixture of the two, often referred to as hybrid learning, many parents have questions about how they should decide whether it is okay to send their child to school. I am going to try to simplify this sometimes challenging task by giving you some specific steps to follow. Each morning, you should start by answering 5 important questions. 1. Is your child's temperature greater than 100 degrees Fahrenheit? This is the standard for New York State. Your state may use a slightly higher temperature as a cutoff. 2. In the past 10 days, has your child tested positive for COVID-19? 3. In the past 14 days, did your child travel internationally or from a state that is on your state's travel advisory list? 4. In the past 14 days, has your child had any close contact with a person who has had or might have had COVID-19? 5. Is your child currently experiencing any new or worsening of the following symptoms? Before I give you these symptoms, please note that excluded from this question would be children with chronic health conditions that are known to the school and known to cause some of these symptoms. Shortness of breath or trouble breathing, cough, sore throat, nausea or vomiting, diarrhea, headache, fatigue, nasal congestion or runny nose, new loss of taste or smell, muscle or body aches, poor eating or appetite, fever, or chills. If the answer to all of these 5 questions was no, your child should come to school, wear a face covering, practice social distancing, encourage good hand washing and cough hygiene. Answering yes to any of these questions means that your child should stay at home. If any of the symptoms that I mentioned are present, you should contact your healthcare provider and request COVID testing. If COVID testing is positive, your child must stay out of school and follow state and local quarantine, isolation, and contact tracing protocol. Additionally, your physician should always be called if symptoms worsen. To return to school, parents may be required to have a release from the Department of Health in order to end isolation, as well as documentation from the treating provider and proof of the test results to return to school. If COVID testing was negative and your child no longer has symptoms for at least 3 days, your child will likely be asked to produce a health certificate from the treating healthcare provider. With your child's condition not considered to be related to COVID-19 and the other symptom-based criteria met, your child will be allowed to return to school. I hope that this information proves to be a useful tool in helping you to know when to send your child to school. Please join me in thanking the American Academy of Pediatrics Committee of School Health, their executive committee, as well as the many committee members who have been instrumental in providing much of this information. I look forward to speaking with you again soon when I will present my next tip on what parents need to know about COVID-19. And please reach out at my contact page on my website with any questions or concerns. And remember to like me on Facebook, follow me on Twitter, TikTok, Instagram, and share me with all of your friends and family.